So we are still discussing on the issue surrounding wound care and why you need to involve a nurse to come and help you do the wound cleaning in your home. Okay, so one of the advantages of involving a nurse coming to clean you and your wound in your house is that it the nurse knows how to observe aseptic techniques. What I mean by aseptic technique is that there are certain way you avoid cross infection. There are certain procedures that nurses have been taught and they know how to do wound cleaning to avoid infection, introduction of infection or crossing infection from the other environment going to the wound. Because if a patient has a wound, they are prone to infection, meaning that they are susceptible, they have higher chances of getting infection because of an open wound. An open wound is an easy access for infection to what you set in. So if you're not following the proper aseptic techniques, you can easily introduce what infection on the wound. So a nurse knows how to do wound cleaning properly. Okay, the other thing I've observed is that sometimes the dressing that is applied on the wound can also affect how the wound is healing. So having a professional care done is helpful in promoting the healing of the wound, because sometimes I've seen patients when they're applying the crepe bandage, it becomes tight, reducing blood flow to the wound and reducing the chances of healing. Okay, so a nurse knows how the dressing is supposed to be applied and what type of a dressing is applied. Do you need paraffin gauze? Do you need to apply cream? Do you need to apply povidone? Do you need to apply crepe bandage, or just gauze is enough? Or maybe just leaving it what exposed. So different types of wound requires different technique of what of dressing. So having a professional care done is way much of advantage than you doing the wound dressing by yourself without proper knowledge on how the wound dressing is supposed to be done and what type of a dressing is appropriate for what type of a wound a patient has. So we are advising the general public that it's better to involve a professional nurse to help you do the wound dressing appropriately. And as therapeutic home care center, of course, we are able to provide such services.